Wow,
What's that?
Teresa.
Teresa, yeah. All right, welcome to our January 7th, 2025 meeting. Please stand and join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, I'd like to welcome our new commissioner, Craig Doolittle, took the control of the northern district of the county as of the 1st of 2025. So welcome, Craig.
Thank you, sir.
Appreciate you being here and serving the residents of Jefferson County along with the rest of us here. Okay, do we have any minutes, Helen? No minutes? Any reports to bring forth?
Yes, the recorder please.
We have clerk and recorder fees. We're gonna see how Ginger does for the month, how much money she brings in for it.
The same in November.
About the same, 7 grand about?
Yep.
Close. 7,100, good job, Ginger, thank you. Show that in the minutes, Ellen, that we received report from clerk and recorder's office, $7,103.75. Any other reports?
None?
Gentlemen, anything to report?
You're not
Nothing for me. Correspondence, anybody get anything in the mail that needs to bring forth to the commission? Helen, do we get anything? We haven't really got much for mail for a while now.
Oh,
You
the
guys
first
did-
mail packet. and-
I got an email from Teresa saying thank you for the contribution again next year.
Okay,
I just sent it to you 2 minutes ago.
okay, all right. You're welcome, Teresa. Thanks for your support down in Whitehall and Boulder. Appreciate it. All right, calendar review. Helen, do we have anything coming up this week?
Yes, well, tomorrow at noon is the Boyd Andrew board meeting. I'm not sure who's going to take that over. That was
Nobody
one that
knows.
Commissioner Mullen.
Yeah, we'll probably have to kind of transition from Bob over, so we'll kind of let it slide for now, and Bob hopefully will let us know where we're supposed to be. Or Boyd Andrew will as well, I guess.
Okay, I've got BTAC on Thursday, but was that held last Thursday or is it gonna be
BTAC or CTAC?
BTAC?
BTAC, yeah, they bumped it to this week.
Okay.
Yeah.
So that's at 8, Trico Fire at 9. Oh, something actually mine. Survey review at 1:30
Thursday.
Thursday. Weed board. The weed board gonna meet
Mhm.
at 6. And basin water and sewer, who knows?
Who knows on that?
I also have planning board. I didn't scroll far enough on Wednesday night at 7. Is that correct?
Yep, that's correct.
Commissioner Haggerty's Friday. And Monday, I show nothing.
Nothing on Monday? All right, thank you, Helen. Craig, do you have any, you probably don't know of any meetings as of yet for this week that you need to attend that she
Nope.
didn't already mention?
Not yet, but I'm gonna go to the one on Thursday for survey
review?
committee with
Okay.
Dan and
Perfect. Commissioner Haggerty, do you have anything to add to that?
I am not sure because I've not seen the agenda yet, but possibly at 8 in the morning, CTAC meeting down in Whitehall.
CTAC, okay. All right, very good. And I don't think I had, there's a safety meeting Thursday morning
Oh,
out at the central shop with either of you guys. What's that?
7?
7 o'clock, yep. Road safety meeting. Okay. Commission reports. This ought to be a quick one. Anything to bring forward, Craig, that you did last week or
I
this
have-
week or?
I have nothing, Mr. Chairman.
Okay, Commissioner Haggerty?
Have none, sir.
Nothing? Okay, you guys gonna make me report on our meetings this morning then? We had a busy meeting day this morning. We met with Doug from DES for half an hour, 45 minutes, and he just kind of gave us a rundown of what he does and what he's been working on and what he's gonna work on, and very good meeting. And we met with the road supervisor after that. Just mostly moving snow. Most of our meeting was taken up by residents' question about a road that has never been there, but it still has a and it's not even an easement, it's a parcel or whatever, a road parcel. That they're trying to push a road in, and we're trying to figure out best next steps for that. Let's see what else. We're gonna try to do a commission road tour up to the north end, hopefully next week. The road department wants us to show us some concerns they got going on up there. Bear's been working with Great West Engineering on the Helford Lane culvert replacement, try to figure out what we're gonna do with that, if it's gonna be affordable to get that thing replaced here in the spring. A bunch of our guys are gonna get roadmaster certificates from, trying to think what they call that, LTAP or whatever.
Yep.
LTAP training, so that's gonna be cool. I think they do those awards at the Mackers conference. And I think that Mackers, did he say when that conference is? Is it usually
The last week?
Yeah, the last.
February?
End of March,
That's
right.
March.
Yeah.
Oh, March, okay.
March, I think.
And I think Commissioner Doolittle will try to attend that conference. It's a good one to go to. And that was the road meeting. We met with the health nurse, Pam, after that, and she went over a few things in the health department. Health safety fairs, January 22nd. I think that's at the high school. That'll be a good thing. Fancy operations for the health department might be affected as they work on the asbestos mitigation there in the old red schoolhouse. We're kind of seeing where that goes. We may or may not be affected by that. We're there only once a week, right?
We're only there Friday afternoon.
Yeah, once a week. So one way or the other, it's not gonna affect us that much, so. All right, after health nurse, we met with the sheriff's office briefly to just go over kind of what he's up to, and he gave us a good report on what he's doing and what some of the issues are at the jail, and just some of his operations, what he's lacking, and where we're gonna try to find funding. We're gonna try to meet with the sheriff every quarter at least, if not more, just to keep in touch with him and try to keep the communication line open with him, so. And I think that was it. I don't think I had any other meetings last week at all. VTAC was canceled, so kind of made a nice short week last week. Okay, what do we got next? Opportunity for public comment. Anybody here from the public? Teresa, do you have anything for us? You're about the only public here today.
I've missed seeing you guys.
Yeah, good to see you.
I've been out for a couple months now. No, I was not able to do my quarterly TAC last quarter. That was about the time I went out on a medical. And so I'll be doing that in a couple weeks. You guys, are you aware that we are joining forces or services with Aware?
Yeah, we heard that.
Okay,
Yeah. Think that'll be a good thing.
yeah, it's still a lot of questions. You know, we're not exactly sure everything that's going on, but I should say I'm not exactly sure. I'm sure those that need to know do. Let's see, it's grant time. So I'll be getting our budget together for fiscal 26. I'm gonna ask for another van. I'm gonna put in for a capital application for another ADA van. Just so that we have another one. We have a couple that are aging out in age and mileage. And I don't want to get caught short and stuff, but our rides are picking up constantly, so that's good. Even though it's the winter time. Basically that's, I think, yeah, I don't really have much other than, you know, trying to keep my head up right now.
Thank you. Who usually attends your TAC meeting? Is that Commissioner Mullen usually?
I just throw it out there to everybody, and
Okay,
whoever can does, and
we're in the process of figuring out which committees each of our commissioners are gonna be appointed to, so we'll get somebody on there that tries to attend your meeting when they can.
okay, sounds good, thank you.
Thank you, Teresa.
I got a question for you. Teresa, how's the transportation been up here in Boulder? Have you had a lot of takers?
We are currently providing daily for the most part, daily services. For a gentleman that, it was arranged through Montana State Fund. And we take him to work in Helena, at 8 o'clock, well, 7:30, I think Shirley takes him. And then she goes back and picks him up, at 5 o'clock when he gets off of work. And, so that's what, $72 they're paying our current public rate, for every ride that he does, and we're billing them on a weekly basis. So that's been we've been doing it since September.
Nice.
For the most part, yeah. But other than that, we've got some people, yeah, I think we're doing really good. Let's see. We had Boulder to Helena, Boulder to Butte, Boulder to Helena, Boulder to Helena, Boulder to Helena, Boulder to Helena, and then Boulder to Helena. That was all the week before Christmas, and none of those were the guy that we're doing on a daily basis. So, it was pretty busy that week. And, we did provide transportation for Beargrass to go out and look at the Christmas decorations. They had asked if they could take a few people, so we did, free of charge. But I think I saw something where they ended up making a donation, after the fact, so that was nice. But it was nice just to be able to do that for those that wanted to.
Great.
So, yes,
Any
we're
questions for
busy.
Teresa?
Thank you.
Craig, you have any
Uh-huh.
questions for Teresa? No?
I'm good.
All right. Thank you. Thank you, Teresa.
Thank you.
You're welcome.
Anybody else got any public comment?
Welcome aboard.
Right?
All right, our next agenda item is elect presiding officer. This is what we do, is it every other year, Helen, about every 2 years, we switch through chairman of the commission, and I think it's about Dan's turn, so I'll nominate Dan for chairman of the commission. Any other nominations? All in favor of that nomination?
Aye.
Aye, I guess you'd be elected by acclamation anyway, so congratulations, you're hereby chairman of the Jefferson County Commission. So I'll give the meeting over to you.
Is that what we're gonna do? I was wondering how that was gonna work.
Yeah,
Now you
that's
know.
where,
Oh, yeah,
that's
that's
where
where it's at.
where we cut the,
Oh, sure.
cheese.
Mhm, mhm. Nice, nice,
The
nice,
date, the
nice.
date has been cut.
Yeah, I guess so. That was
It is
quick.
out.
Yeah. All right. Now we gotta look at, which if I can get from Ellen, please, resolution 01-2024. Oh,
Five.
or
Five.
two. Oh, it's 2-4
Oh.
down here. Everything's 2-4.
Well,
You're right,
yeah,
2-5.
that's
Okay.
yeah, good catch.
Stand is red.
2025.
Okay, setting meeting date for Board of County Commissioners, whereas the governing body of the county will by resolution establish a regular meeting date, notify the public of that day. And whereas the governing body of the county, except as may be otherwise required of them, may meet at any time for the purpose of attending to county business. And whereas it was further determined that claims would be approved every Tuesday morning, and that the commission will meet with the road supervisor for departmental updates and with individual department heads starting at 9:30 a.m. on Tuesdays as needed. And whereas the Board of County Commissioners of Jefferson County, Montana has determined that every Tuesday at 1:30 p.m. is the best time for the regular meeting for the purpose of conducting its official business. Now therefore be resolved that every Tuesday at 1:30 p.m. of each week will be the regular meeting date and time effective the first day of January 2025. And that every Tuesday morning of each week, starting at 9:30 a.m. will be the time set for claims approval, followed by road and other department updates. Robert's Rules of Order shall be adhered to these meetings. The commission will recess for lunch and reconvene at 1:30 p.m. for their regular meeting, to conduct official business. Be it further resolved that the policy providing for public participation, blah, 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 public meetings, is stated in resolution 05, is that 05-2004 will be continued, dated the 7th day of January 2025. Okay, we got to vote on this, right? Okay. Okay, do I have a motion to approve?
I'll move we approve resolution 01-2025.
A second?
Second.
Okay, all those in favor? Say
Aye.
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 Okay, so be it. What if you find first since you're over there? Okay.
There's a Bob's water bottle.
What's that? What?
Every week, Bob will go get a bottle of water. I never drink it.
Oh.
We usually take it to water the plant. I left it last week because we were like.
Oh. Yeah, it was last week and you're not here to drink it today.
Okay, resolution 02-2025, which is establishing office hours. Okay, whereas Montana Code Annex stated 7-4-102 stated that unless otherwise provided by law, each officer shall keep their office open for the transaction of business during the office hours determined by the governing body. And whereas the commission has consulted with the elected officials to determine their office hours. And whereas other county offices excluding elected officials may require different office hours based upon the number of employees and availability. But that public access to staff and public documents must be maintained as best county department budgets permit. Now therefore be it resolved that all Jefferson County elected officials' offices shall be open between 8 AM and noon and 1 PM and 1 PM or 1 PM and 5 PM with the following exceptions: county attorney's office, justice court, treasurer's office, sheriff's office, county superintendent of schools, which states 8 to 4, as for the county attorney and justice court, treasurer's office 8 to noon and then 1 to 5, and the sheriff's office is 24 hours. And the county superintendent of schools, Mondays and Tuesdays 8 to noon, and then 1 PM to 5 PM, and Wednesday 8 AM to noon. 7th day of January. Okay.
I'll move to approve resolution 02-2025, Mr. Chairman.
Thank you. Have a second, sir? Second. All those in favor?
Aye.
Aye. You didn't tell me I was gonna need a bottle of water.
Enjoy your coffee there.
I'm almost out. Okay. Next one is gonna be resolution 03-25, setting per diem and mileage rates. Thank you. Resolution 03-2025, setting per diem rates and mileage claim, whereas the governing body of the county shall by resolution establish a per diem rate for mileage reimbursement for in-state and out-of-state. And whereas the governing body of the county shall by resolution establish rates for in-state and out-of-state meal reimbursements and in-state and out-of-state lodging reimbursements. Now therefore be it resolved, the following rates shall be set for the reimbursement of mileage and meal reimbursement and lodging. Standard mileage will be 70 cents per mile up to 1,000 miles and will be 67 cents thereafter. And then state lodging rate of $110 plus tax, other than those specifically listed as high cost areas such as Gallatin County, Park County, Lewis and Clark County, Missoula County, and Flathead County. Out of state lodging rates are subject to the federal per diem rate set by the U.S. General Services Administration by state. And meal reimbursement shall be as follows. In state, the morning meal between 12:01 AM and 10 AM is $8.25. Midday meal between 10:01 AM and 3 PM is $9.25. Evening meal between 3 PM and 12 midnight is $16. Out of state, the morning meal between 12:01 AM and 10 AM is $13. Midday meal between 10 AM and 3 PM is $15. An evening meal between 3 PM and 12 midnight is $26. It is the 7th day of January 2025. Do I have a motion to approve?
I'll move to approve, Mr. Chairman.
Second.
All those in favor?
Aye. Do those follow state law now, Helen, or are we still ahead of state law, do you know?
I don't think we're in line with state law.
So we were above it a little for a while.
I'm looking at the email from Mako right now. And
Thank you.
the state meal rates are 8.25, 9.25, and 16.
Yep.
But general services administration, so federal rate is 16, 19, and 20, or is. Yeah, 16, 19, and 28, so we're kind of in the middle of them.
Hmm.
For state and other.
All right, as long as we're keeping up with the state.
Well, the state always seems to, they went a long, long time, and they had like breakfast at $4.50 or something like that. I can't even buy a Happy Meal for that. And I think they're kind of behind the curve in keeping up with, certainly with inflation.
Looks like it was updated at the last legislature, so maybe they're about to see it again. They are behind.
Yeah, they were long behind before.
Okay, resolution 04-2025, a resolution designating posting places for board agendas and meeting notices. Whereas the Board of Jefferson County Commissioners and Advisory Board and committees and all special district boards must ensure their meetings are open to the public pursuant to 7-1-2123 Montana Code annotated, and whereas the governing body shall adopt procedures that assure adequate notice and assist public participation before a final action is taken on a matter of significant public interest pursuant to 2-3-103 (1) Montana Code annotated. And whereas there's more than one publication in the county and no central locations where public notices can be posted in order to be accessible to all Jefferson County residents. Now therefore be it resolved that the Board of County Commissioners hereby designate the following public places for posting notices and agendas: Jefferson County Courthouse, Whitehall Post Office, Boulder Post Office, Clancy Post Office, Jefferson City Post Office, Basin Post Office, and Cardwell Post Office. Now therefore be it further resolved, as there are 2 publications in Jefferson County, every agenda for a public meeting shall be faxed or emailed to the following newspapers additional to the above cited public postings. Publishing the agenda in the newspapers is dependent on whether the publications choose to publish. Whitehall Ledger and the Boulder Ledger. Dated the 7th day of January 2025. Do I have a motion?
Ledger or Board Monitor?
Or what did I say? Oh, yeah, it has Boulder Monitor. That's not right. What is that?
Yeah, Monitor now.
That's the monitor.
They
Yeah.
changed their
It's got,
Ledger is
it's got, yeah. So it's got Boulder Monitor.
That's okay.
But the monitor, you're right. Thank you. Okay, any other discussion, or do we have a motion to approve?
Make a motion to approve.
Okay,
Well, second.
second. Okay, all those in favor?
Aye.
Aye. Okay. Thanks for pointing that out, though, that's true.
Yeah, we need to, anything for the Boulder Monitor is now the Monitor. He didn't even really, I don't think, put that out, and he just changed it quietly.
I think he wrote about it last week, but
What did he?
At some point, yeah. I
Oh,
think
Keith,
we
me?
had-
Mhm.
Yeah. I think
Yeah,
that's-
something.
And you got the lease agreement? Yep, there it is, yep.
You gonna read that?
Yeah, I went through it.
Or you could have.
Am I gonna read that, what
Yeah.
you said?
Abbreviate.
Abbreviate it.
We'll pass it around, and everybody after you're done reading, let me know.
We probably don't have to read it, Mr. Chairman. This is just an update from
Okay.
the previous one. It pretty much trades our lot rent for snow removal and septic pumping yearly and snow removal when needed.
Yeah, and I think they do, Commissioner, I think there's also in there, they do some weed
I think there's
Oh,
some.
we-
eating around certain areas in the summertime,
Yeah.
but it's pretty straightforward. I think it's a 10-year term is what we set it at, and it's been vetted through at least the chair of the, is it a fire department?
Fire district, yeah.
Fire district,
Yeah.
we being the county had asked that it be circulated around. I know Terry has looked at it. She sits on that board, so. Yeah, I think we're good to go with it, and it's kind of no other space.
Yeah, we're lucky to have that little spot there actually, till we outgrow it.
Okay, do I have a motion to, or is it,
I
To
would make a motion to approve the solid waste site lease with Jefferson City Volunteer Fire Department.
I'll second that motion.
any other discussion? Outside of that, then all those in favor?
Aye.
Aye.
One for sign here, I think.
Oh, you know these too well, don't you?
And I should have had Steve change it to you since you're now chairman, but
I think it's all right.
the transition.
Proxy chairman.
This one's for me, or twice for me.
Oh, I see
One's
what
for
you did. I
yeah,
got
yeah.
you. Okay.
One signature is actually for the, what we call the solid waste board, which is us,
Mm-hmm.
and the other one is.
Okay, to the board over
Yeah.
there.
Yep.
Okay, now we're narrowing down. As for Pam, the presentation of your findings of the community health assessment and community health improvement plan.
You have a PowerPoint. There's not much public here, so either try it or
We can give it a go. Sometimes it works, sometimes it doesn't.
I'll just talk to you if it doesn't work. Got a slideshow.
There it is. I
You
don't
can
use,
start at the beginning.
I don't use this enough to know.
So, in February of 2023, the Health Department received funding from the Systems Improvement Office at DPHHS to do a community health assessment and community health improvement plan. And, it's been a big project. It's taken quite a bit of time, and there have been a lot of people involved. This is the final document for the assessment, and this is the final document for the community health improvement plan. Next slide, please. So a community health assessment, or a CHA, which we refer to as a CHA, is a systematic data-driven approach to determining health status, behaviors, and needs of residents in a specific community. So Jefferson County is the community we're looking at. And every 3 to 5 years, health departments are encouraged to conduct a CHA to capture a collective view of the health in their county. So that's the purpose for this. We didn't take this on alone. Like I said, the Systems Improvement Office from DPHHS helped with funding and technical support. We also hired a contractor, Yarrow. They're a Montana-based public health contractor to help us get these beautiful documents put together. But there were a lot of people locally that really were part of this. And if you look at front of the community health assessment and at the community health improvement plan, it gives you a list of the folks that were involved. And so as you can see, there are quite a few people that were involved in this, including a core committee who was involved in the last CHA and CHIP. And because I wasn't the supervisor then, I wasn't involved. And so I really relied on some of those people like Drew Dawson and Barb Ryder and Jody Smiley and LaDana, who had served on the previous one. And then Jim Murphy and I kind of brought our little scope into that core committee. And these are the people I mentioned that facilitated, but this community stakeholder group are a bunch of people that this core group took a long time to try to decide who could give us good voices so that we could get voices from different people, from young, from old, from different parts of the county, from people with different needs. And as we got into this, and we know this from living here, you know, there really are a lot of different socioeconomic determinants in this county, from the north end to the south end. There's also a lot of different ages and a lot of different occupations and interests. So we really tried to find people from all of those different sectors to help provide a voice into what we were doing. So next slide, please. So as you can see, we collected both primary and secondary data. So primary data really are those voices, those people that talked to us, that answered surveys, that came to focus groups and attended our meetings. The secondary data, you can see that list is pretty long, and these are reputable sources for data that we collected. And one of the fun things that happened when we were collecting secondary data, and I think that took us probably the longest part of this, was to get all that data collected and to get it analyzed. But it was during the summer that we had Callie Warfel as our intern that we were doing that. And she had just graduated from Carroll with a bachelor's degree in public health. And so it was a great opportunity for her and for us to be able to involve a local youth in that part of that data collection. So as you can see, there were a lot of different sources that we used, and they're quoted in here. Next. So from those different areas, that secondary data and that primary data, the survey and our stakeholders and key informants, you can see that we identified some areas that we wanted to look at that were areas of concern. And where there's an X in each category, those showed us that those were probably areas we needed to pay a little more attention to, because obviously we can't eat this elephant whole, and that we couldn't do all of that, what we were looking at as needs to improve health and well-being. So these ones from here up were really the ones that we took to our stakeholders in the end and said, okay, it looks like these are the areas that have the most concern. And so from there, we narrowed it down so that we could find a couple of priority areas. So next slide, please. And those areas are really ones that are really going to help us to know what we focus on and how we make improvements, how we look at policies, and that's what we're looking at. The other thing that we looked at, besides primary and secondary data, are social determinants of health. So economic stability, education access and quality, healthcare access and quality, neighborhoods and built environments, and social and community context. We know that a lot of health really is determined by who we are genetically, where we live, and what kind of support we have. If you look at this, I think this is a really interesting diagram. And if you look at this, only 20% of the health of an individual is really tied to healthcare. So most of that other thing, 80% of our health is really tied to those socioeconomic factors, where we live, the physical environment that we live in, and behaviors that we choose. So we did look at those social determinants of health too, as we were talking to people and surveying. Next slide, please. So this CHA identified several strengths of Jefferson County as well as challenges. So we looked at what are the challenges we have, what are the strengths we have, and what opportunities do we have for improvement. And we really found that residents in Jefferson County have a real sense for wanting to have health and wellness and well-being. We've got things like, healthcare providers. We don't have a hospital, which is a challenge, but we've got local healthcare providers who've been here for generations, who've provided lots of care for us and who've sacrificed so that we can have care. We have a lot of social service entities. We care for people very well. We've got Montana Developmental Center, which we've had for generations, and we've got 10 facilities between long-term care and residential facilities. So we really are strong at taking care of people and caring about them. We also have the hot springs, and we have the mines, and we have things where people really are concerned about health and wellness, and they look at alternative ways for healing. So that's another strength. I like this quote that one of our survey respondents said, that Jefferson County is an amazing place to live, despite some shortcomings, which are present in nearly all rural areas. Believe me, in our survey, we heard about some shortcomings. It is still one of the best places for community and quality of life. And I think, we choose to live here for a reason. We do enjoy living in Jefferson County, raising families here and growing old here. So those are some of the things that we found for strengths. Next slide. So after we did that assessment, the next step was to do this community health improvement plan. And so we looked at this plan and we said, what can we use from those priority areas that we found, those strengths that we looked at, that we can make some improvements in overall health for our folks? And so you can see the improvement plan is a lot smaller than the assessment. And we were able to get through it fairly quickly. But we did choose 2 priority areas. So next, and this wasn't just our core group, it was this community stakeholders that really helped steer us where we were going. In fact, at one point I asked if I had veto power and they told me no. So there were things I wanted that we didn't get to do. So that's why I'll stay and do another one, see if I can get my priority in there. So the 2 areas that we chose were priority 1 was mental and behavioral health, which was no surprise to us. It was actually a priority area in our past 2019 community health improvement plan. And the second priority was healthcare access and quality, which is a social determinant of health. And as I said, without a hospital in Jefferson County, we really have to resource outside of our county to get a lot of the services that we have. And so we looked at how we can have healthcare access here, how we can have quality healthcare access, and what we can do to eliminate some of those barriers to access. And I was really excited to hear Teresa say that the transportation was picking up in Boulder and how well it's doing in Whitehall. That was one of the strategies that we worked on in our past community health improvement plan, was how do we get local transportation? Because one of the barriers to access to care is lack of transportation. So I was really happy to hear that we're doing well. And we did look back at a lot of those strategies and objectives from the last Chip and Chaw so that we could continue to have some momentum in some of the things that we were doing and to look at where we needed to make other improvements. So next slide. So really the next steps, and I'm not going to go over every single one of these. In that first objective, we've got mental health and behavioral health. We've got that priority, we've got 2 objectives. So we're going to try to reduce the incidence of our youth reporting sadness, which we looked at through the YRBS, and we're going to try to reduce the incidence of suicide in our county. And what was interesting to me is in that those years that we looked at, it was adults who were dying by suicide. We were losing adults, and most of them were men. So it wasn't our kids that we were losing during that period of time. So we have several strategies we're going to work on to see if we can figure out what's going on and how we can prevent it. When we lose children to death, any kind of death, public health does an assessment to look at what we can do to prevent it. And so we've decided to do something similar with these adult suicides to see if we can figure out how we can put in some prevention measures. And then with access to care, we're really trying to do 3 things. We're going to try to increase our screenings so that we're doing preventative care. We're going to try to increase access to health insurance. We'll be doing some health insurance workshops to help people get enrolled and know what they qualify for. And we're also looking at EMS because we don't have a hospital and we don't have an emergency department or an urgent care. A lot of our acute care and acute needs fall on our EMS system. And so we're doing an assessment of the EMS system and looking at some strategies there to improve the standard of care that we're giving. So not just time. We're not just looking at response time. We're looking at quality of care that's given. So those are some of the goals that we have, the things we're going to be working on. And so as we go forward, this is a multi-year effort. Our final goals are in 2027, and at that point, we'll start another process of assessment and improvement plan. Those lead stakeholders, the people that are named in these documents, are going to be engaging in regularly to look at what we're doing to move those strategies forward, those things that I just talked about. That core committee that I named, Drew and Barb and me and Jim and LaDana and Lindsay and Jody, we will meet regularly to look at we'll look at assessing where we're going. deal with any challenges that we have in the progress. And then we'd like to do an annual meeting where we present where we are at with it. So something similar to this, or maybe at the fair, or, you know, we'll figure out. I'd like to have had more community members here, so we'll try to figure out how we can share this more with our community. We're working on some social media campaign to get the word out. The Monitor has been very gracious to us. They've had a couple of different articles on our assessment and our improvement plan. And Liz at the Ledger also has run some articles for me. So we're working on ways to get information out and to get people to return to us and say, I'd like to help in this area, because this is really, it's for everybody. It's for our community. And I've been pretty happy that we've actually had some engagement with the community and reaching out to us and saying, I'm interested in this that you're doing, or how can I help? So,
Great.
so that is what we're doing with our improvement plan. Are there any questions about that?
I have a question, Pam.
Mhm.
In there, you've got some data in here with respect to firearm fatalities, and it basically, for this reporting period, excludes homicides. Are these self-inflicted gunshot wounds primarily, or are they firearm accidents?
They're both. And we knew we'd get asked that, and I wish we could delineate, but we didn't have the data to.
You didn't break it out, okay. I was just curious.
Yeah.
because-
Yeah, and you know, I know Leah has used that assessment a lot, in seeking grants and seeking, funding. So this can be shared and spread far and wide. I think there might have been one more slide that said, both of these documents are on our website, so the public health website. And there is a QR code too that you can get to it, and then so you'll see that around and about. But if you go into, or you can contact me at my email. So please share and encourage others to use the document. There was a lot of time and love put into it, so we hope that it'll be used well.
Great.
Any other questions?
Good job, Pam.
Yeah,
Appreciate it. That's great.
Thank you for giving me time. I appreciate it.
Was there improvement for 2018?
Yes, and you know, the thing that was hard with that is we were in the middle of pandemic, so we didn't have all those next steps going on where we're, you know, assessing and working toward it. But we really did take time to go back and look at what had been done before and to evaluate where we were at with things. And so, yes, we did see some improvements. We also put some of those things that we were working on, but not quite there, back in, like, one of them that comes to my mind is, thank you, trying to get PACS, but good behavior game in all of our schools. I know Clancy was our first one, but in suicide prevention, that social learning is one of the things that Carl Rossi is telling us that is really impactful for kids. They learn that young, then we see less suicidality and less mental health issues as they grow older. So we now have 3 of our 6 elementary schools using it. So we've gotten 50%. So we put it back in. We're hoping to get a couple more in there in the next couple of years. So, but that was just one example. And then, like I said, the transportation, we've seen real improvements with that too. So. Thank
Pam,
you.
appreciate it. Teresa, what day is that meeting you guys have down there all the time? Transportation?
Are you talking about my TAC meeting?
The what, yeah, your TAC meeting, I guess that's the one you send out to everyone in the email, is that right?
Yeah, it's on a Wednesday, or no, Tuesdays. So it should be the 21st.
What time Tuesday though?
2:00.
Okay,
That's why none of us ever make it.
that's fine, yeah.
Tuesdays are bad days for the committee.
Do we need to change it? I can move it to any day. There's no preference for me.
Let me get with you and I'll take it, okay? I'll be the representative for down there.
Cool, thank you. Yeah, we can make it any day, pretty much anytime.
Okay, I'll get with you because I'm not sure right now.
All righty, thank you.
I appreciate it, thank you.
Uh.
Okay, is there anything else for discussion that's not on the agenda, so to speak? If not, then we'll be adjourned.
All right. Thank you, Mr. Chairman.
Well, thank you. Well, I'm not gonna say ex, Mr. Chair, but you're welcome, Mr. Chair.
Past president. Thanks, Teresa. Have a great day.
Okay, that one's covered then. I'll just have to work with her and see what day I can go with her.